Mr. Chairman, you're live on YouTube.
Very good. Welcome to Labor Health and Social Services Centers. Welcome those who are with us today, live on YouTube or wherever you find yourself on the world of the internet. We only have one bill up for consideration this morning, House Bill 3. House Bill 4, which is temporarily on the agenda, is still in the House waiting third reading this morning, so we won't be hearing it. Just a couple of reminders before we do roll call. If you got on the invite page, there's a place if you wish to testify, you need to hit that testify button. We don't worry too much about cell phones here because we're all in a lot of different locations. Prefer to keep the distractions to a minimum if you're testifying for the committee. I don't anticipate that we'll have too many people in the committee at once. As a matter of fact, if we don't have an overwhelming number of people, we may just let everybody in that's going to testify into the room at once so we can see everybody's face. We like to keep this fairly informal. As always, all comments, questions, etc., need to go through the chair. And I'm a pretty easy guy to get along with, so I'll always acknowledge you. And with so few of us on the screen, it's easy to see you. So if that's out of the way, let's go ahead, Amanda, and do roll call, please.
All right, Mr. Chairman, Senator Bouchard.
Here.
Senator Furphy.
Here.
Senator Hutchins.
Here.
Senator McEwen.
Here.
And Chairman Baldwin.
Here. Welcome, committee. Everybody's here today. That's a good sign. I've asked Senator Bouchard to take the lead on this bill this morning for us to present it, read through it, and then we'll do some questions and we'll let the public in to give us some more comments. I'm sure there's a few comments, but we've worked this bill pretty hard and some long hours on this bill, as a matter of fact, as Senator Bouchard would recall. It's a good bill. I think we've got it worked out to a good degree, but you may find some things, and that's what we're here for, is let's put out the best bill we can out on the floor. So take it away, Senator Bouchard, if you would.
Thank you, Mr. Chairman. What I'm presenting is House Bill 3, Certified Addictions Practitioners and Certification Amendments. So before we go into the bill, I want to talk a little bit about what has happened here and why we're doing this. There's been a lot of discussion on these issues with the licensing board, and there wasn't a clear path to allowing the licensing to work properly. And I guess part of it is because of old language that we just haven't been able to get rid of. So now we're moving forward, and this does that. So this is related to mental health professions licensing certification, and you'll see if we go down to the bottom of the page, certification under this subsection shall allow practice as certified addictions practitioner, and continuing to the next page, only under the supervision of a qualified clinical supervisor. And let me tell you, that has been a lot of the contention that we've had. It's not that anyone was practicing in the past, not using that guideline. It's just now we've got to try to make sure that we're doing this in a way where everybody, all parties, all stakeholders can be pleased with this instead of us all getting in the fight over this. So, and I'm sure the chairman can agree on this. So as we go down in this bill, the board shall grant certification. So I'm on line 3, page 2. The board shall grant certification as certified addictions practitioner to any applicant who files an application. And that's kind of been always the case here. But as we get down here in the next paragraph, we've had a lot of problem in who applies those standards. And so what happened is we had maybe different timelines and when people got degrees from different states, different colleges, different universities. And there were just things that were a little bit different. And they may have been able to practice in one state and maybe not so much here because we just didn't have a standard. So what we're doing here is we're allowing the board to come in and accept national standards for accreditation in the field of addiction therapy as accepted by the board. And the way that it was before is the board had to kind of make the rules. And, when you get a bunch of people in the room, they probably couldn't decide on what those rules were. So we're just trying to make this a lot easier, streamlined process. And there are already standards nationally, and other states have done this. So I think this is a great move. So as we go into line 18, in performing its duties under this paragraph, the board shall consult the professional training experience standards of the National Professional Associations. Anyway, this is back to standards. We're just making sure the board has a way to point to standards, and we've codified that so that way they can do that efficiently. On the last page, we've also got a person who has received a bachelor's degree in human behavioral discipline other than a degree in addiction therapy may be granted. Now, this is a really great deal here because this allows, we have people that are already practicing in both mental health and addictions. And what this paragraph does is allow both, makes that happen the way it's been happening already. And this gives the flexibility of the board. There may be people who practice or even coming into addictions therapy. This allows the board to make those adjustments. So I really think, and we also have the 2,000 hours supervised work experience. I mean, we can ladder in here. We've got a practitioner assistant or equivalent in the field. So I think this is a great bill. I mean, we've got, with the states that are surrounding us, we want to make sure we're prepared for what's coming and not reactive to it. So I think it's a good bill, and I urge your support.
Thanks, Senator Bouchard. Any committee members have any questions or comments? Senator Hutchings.
Thank you, Mr. Chairman. Thank you, Senator Bouchard. You clarified a lot of things that I had questions on with your presentation. I do have a question on page 2 at the very top, lines 1. I'm trying to visualize what it's like to have someone that is a certified addiction practitioner having a clinical supervisor. And then I'm visualizing the same person having their own practice. Can you explain to me why that supervisor section is really needed? Thank you, Mr. Chairman.
Senator Bouchard.
Thank you, Mr. Chairman. Yeah, this is where we start getting into a lot of areas that where you have, I'm going to use some examples that I do know of. So when we have let's say a state contract position where, or even a provider that has a contract, what we run into problems with is we have somebody who's maybe laddered in on a license such as this. We want to make sure that they're not just running on their own, and they have to work under somebody who's supervising and has the required hours and training and license to supervise. So without getting too complicated on this, that's what's going on here. We can't have people coming into the field who aren't ready to be independent and work on their own and didn't go through the right process and training. So that's what that section is about right there. It's just really simply, they cannot work on their own until they get to a certain level. And this bill doesn't necessarily have all of that. There's other places where that board is going to make sure those qualifications are there. So I hope that answers your question.
Yes.
And I would,
Mr. Chairman?
go ahead, Senator Hutchings.
Thank you so much. Now, if we go to page 3, I noticed that the House made some amendments. You mentioned the 2,000 hours, and that was deleted and exchanged for an equivalent or greater number of hours. So it's like we kind of changed things there. How do you guys like that, where it says proof of completion of, we took out the 2,000 hours and just said an equivalent or greater number of hours? What does that mean to us now that they've made that change?
Yes, Senator Bouchard, if you have an answer for that. Otherwise, I know some of our attendees today who are actually at that House meeting will be able to give us a little bit more of an answer for that, why that was changed. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. The reason that change is there is there's going to be certain complexities that the board is going to have to make adjustments for, and that allows them to do that. So I think that's just the simplest answer for that. It's not that we want to lower those hours or even raise them. We just want to be flexible so the board has the ability to move forward and bring professionals in as they see the need.
And quite sure, Senator, thank you, Senator Bouchard. That some of our attendees will give us a little bit more fleshing out on that, and will be able to help us out on that. The committee will note that we will hear several topics very similar to this as we go through this year and all the next 2 years for sure, probably the next 200 years. We're going to talk a lot about boards and how they do things and how they give qualifications, et cetera, on many different boards, medically related. So it's a good thing to get under your hat and to learn as much as you can about that. It would be optometry, which you'll probably hear about this year, the Board of Medicine, Board of Nursing, et cetera. So it's a frequent topic on this committee radar. So any further questions for Senator Bouchard? Senator Furphy, you had one. Do you have one now?
Thanks, Mr. Chairman. That Senator Hutchings got to the gist of my question also. So, yeah, I'll wait to hear what we have in testimony. So thank you.
We are. And Amanda, let's just let all 4 of those attendees in. I think we can handle that big number of people in here, if you would. Good morning, folks. I'm beginning to see some familiar faces there. Mr. Craig, good to see your smiling face this morning. Andy, as always, it's good to see your smiling face. Committee, these are all people you're going to see a lot of this year. Every meeting, pretty much. They hope so. They enjoy spending time with us. And finally, I see Greg about to pop up in front of us there. Lindsay doesn't want us to see you this morning. So does anyone like to jump in and be first here? Go ahead and raise your hand and I'll acknowledge you. We'll get you up in front of us here. Mr. Craig, go ahead, please.
Thank you, Mr. Chairman, members of the committee. My name is Frank Craig. I'm the president of the Wyoming Association of Addiction Professionals. I also run the Wyoming Department of Corrections treatment programs. Came up here about 5 years ago from Texas. And we have worked a very long time on certification for addictions professionals. And I do agree with you, Mr. Chairman. This is a very good compromise. And I think it helps move ladder up for addictions professionals in the career.
Hold on one second, Mr. Craig. Oh, she just muted. I was going to say bless you to Lindsay and then make sure she mutes. Go ahead, Mr. Craig.
Thank you, Mr. Chairman. And in my experience, and this might be helpful for Senator Hutchings to understand too, because I did practice in another state in Texas with a bachelor's degree that allowed me to procure a license in the state of Texas that I could operate independently. That's not the case in Wyoming. The way that our certifications and licenses are structured specifically for addictions professionals. With my 4-year degree in sociology in Texas, I still had to do a counselor internship as well as gain the necessary educational hours that were required and pass a national examination in order to receive my license in Texas. What we're trying to do here is build a similar ladder using the CAPA, which is the kind of first step in the ladder, if you will, for an individual to be able to start practicing in the field under supervision. A CAPA doesn't have the ability to perform some of the therapy that a CAP or an LAT has the ability to do. And the CAP still has to operate under clinical supervision. This bill does a couple of things. First, it redefines the type of bachelor's degree that's allowable. Under the current statute, it refers to a human behavioral or a human resource education, which is a little bit confusing and outdated language. So updating that to reflect in a behavioral area really has a better perspective for what kinds of degrees would be allowed.
Okay, Mr. Craig, I'm going to hold you up for a minute. I believe Senator Hutchings has a
Yeah.
question here for you.
And I don't mean to interrupt, Mr. Chairman, but this is going to be very, very important for me moving forward in this committee. You're using a lot of acronyms, CAT, SAC, DAT, whatever. And this is my actual second day in a committee, or third. You've got to explain what those mean, or you're going to lose me trying to figure out old military. What is that? What is that? That's going to stay in my brain and keep me back here when you're way up here. So please help me with the acronyms if you could. Thank you, Mr. Chairman.
Very good point, Senator Hutchings, and I would remind all the presenters that that's a handicap in this committee, is we have a lot of acronyms, and we talked about WAMSAC last meeting, and yeah, so we'll get there. Keep your list that I gave you all earlier at hand, because there's a lot of acronyms. But all the presenters, if you wouldn't mind spelling those out for us, I appreciate it. Go ahead and continue, Mr. Craig.
Thank you, Mr. Chairman. Yes, Senator Hutchins, I didn't mean to lose you there. In Wyoming, there's 3 tiers of addictions professionals. The first one being the CAPA, that's a certified addictions practitioner's assistant. It is equivalent to in a national accreditation, a national addictions counselor level 1. It requires initially no degree, but it does require 270 hours of very specific addictions related and counseling related courses, and then passing a national examination to obtain that. The next level, and the one that we're talking about now, is the CAP, Certified Addictions Practitioner, which does require a bachelor's degree, and at the national level is equivalent to that National Addictions Counselor 2, level 2. And then the third tier is the master's level, which in Wyoming is a licensed addictions therapist. And there's a couple of different national master's levels. The one that I'm familiar with as our association is connected as an affiliate to NADAC, which is the National Association of Alcohol and Drug Addictions Counselor. That master's level is a MAC, or a Master's Addictions Counselor. As I've mentioned, so the definition of what type of degree as being a behaviorally related degree is an important piece. It updates the language in the statute, and it kind of gives us a better idea. We're looking at things like sociology degree, a psychology degree, a social work degree, those things that are really more in line with mental health and addictions counseling requirements. And that's why, as Senator Bouchard had explained on page 2, about line 15 and 16, we're really trying to correlate some standards that are really accepted in many other states to bring that decision-making process when the board is reviewing applications to provide a little bit of guidelines from national standards. And then the main thing that we're really looking at on page 3 is how we're bringing into the equation some kind of supervised work experience. Right now in Wyoming, there's no requirement at the bachelor's level to have any kind of supervised work experience. Nationally and in other states, they set those supervised work experience hours differently. Sometimes it depends on the type of degree that a person has. And sometimes it's just a matter of what their state feels is adequate enough for the individual to go and take the examination and prove competency. And most states, even at the national level, do allow for a bachelor's level person to provide clinical supervision in addictions. And I'll stress that in addictions because, of course, if you're in a different domain as a master's level, let's say as a licensed professional counselor that does require a master's degree, of course you would want a master's level clinical supervisor. But in the addictions realm, it's not the same. Even nationally, the credential for a national clinical supervisor, the bachelor's degree is sufficient. But the important piece here is we're bringing into play now the supervised work experience hours, which we've not had before in Wyoming. What this would allow a person to do in the career ladder would build upon their CAPA or their certified addictions practitioner assistant after they've obtained the proper number of hours, which is 2,000 hours, I believe is the way that the bill still reads. That's about 1 year of supervised work experience. That also allows them some additional time to continue working on their formal education, be able to achieve that bachelor's level degree, and then take the national examination that's appropriate and be able to obtain that CAP level. So it's just another step in the career ladder. And I think I pretty much explained all of that. Again, it's a great bill. Looking forward to seeing that move through successfully. And with that, I stand for any questions.
Any questions, committee? Senator Furphy, go ahead.
Thank you, Mr. Chairman. The bill talks about, and you mentioned, the appropriate federal agency. Give me that name, if you would, again, of what is the appropriate federal agency that sets these standards. Thank you.
Mr. Craig.
Mr. Chairman, yes, Senator Furphy is a federal agency that would fall out of the Department of Behavioral, and I'm trying to think of the name of the acronym because there's a division of it, and we call it SAMHSA, Substance Abuse and Mental Health. I don't know what the A stands for, but they actually set a large amount of requirements, and in fact, they put out training manuals that are very specific to addictions professionals. They're called TIPS and TAPs, and there's actually one that is called a TAP. This is a technical assistance guidebook that is very specific to the kinds of supervision that would be required for addictions professionals. It sets out different domains that are expected for people who are going to be practicing in the field to show competency in. And those are typically things that would otherwise be reflected like on a national examination.
Any follow-up, Senator Furphy?
Well, yeah, give me that acronym again, if you would, please.
Mr. Chairman, yes, Senator Furphy, it's SAMHSA. I believe it's substance abuse and mental health. Again, I don't know what the A stands for. Escapes my mind. There may be somebody else that's on the call that could fill in.
Andy is reading it with her lips there as you're saying it. I suspect she'll give that to us, Senator Furphy, when we'll get to her next.
Thank you.
Any further questions, committee? Thank you, Mr. Craig. We appreciate that presentation. Ms. Somerville, that brings us to you. And I guess the first thing you got to tell us is spell out that acronym for us, please.
Thank you, Mr. Chairman. Andy Somerville with WAMSAC, Wyoming Association of Mental Health and Substance Abuse Centers. And it is SAMHSA, which resides under HHS, which is the Health and Human Services Agency for the federal government. And SAMHSA is SAMHSA, and it's Substance Abuse and Mental Health Service Agency. So
Very good.
Thank you, Mr. Chairman. With that, I think most of the pieces of the bill have been touched on, but I did want to clarify with Senator Hutchings. So I believe there were 2 amendments that were filed on the bill in the House, but one failed and one was withdrawn. So the 2,000 hours requirement is still in the bill as it sits before you today. I think there was discussion on the floor, but ultimately they decided not to change that language. So in particular for addictions practice, our community mental health centers, this is a significant area of practice, both in residential settings and outpatient settings. I think just in general, I'll say that this is a bill that we've worked hard on. Lots of conversations with Mr. Craig and Ms. Semino to try to work out something that we could bring to the legislature. We do think that, it does clarify and clean up some language that we needed to, as well as creates that new pathway to, again, support and build that career ladder. I think it's important, and you'll see this with probably 004 when it comes forward to you, hopefully this week. We're concentrating a lot on workforce development and in terms of growing our own. So we want to help the people that are here that are already involved in the area of mental health and substance abuse services to grow their credentials and to stay involved. Hopefully increase our practice numbers. As again, I would remind the committee, we are a HPSA area, which is a healthcare shortage designation from the federal government in mental health and substance use disorder providers. So with that, I'd stand for any questions that anybody might have.
Senator Hutchings, go ahead.
Thank you, Mr. Chairman. And this is for Andy. I'm assuming you listened to the debate on the House floor. Good. And the reason why I asked that is some of the members voted no. Did they give you a reason, or did you hear reasons why we would vote no for this bill?
Ms. Somerville?
Mr. Chairman, Senator Hutchings, I think there was some concern discussed on the floor in terms of the hours requirement. Is a year enough? There was a lot of discussion about what NADAC, which is the National Addictions Professional Association, essentially, what their requirements are to actually to obtain their credential at the bachelor's level, which is called an NCAC 2. And I might have to ask Mr. Craig exactly what the NCAC is, but essentially it's a National Counselors Association credential at the bachelor's level. They have some different requirements to get that in specific higher work hours to get that credential. But it's important to, I think, differentiate obtaining the credential from NADAC and kind of what's in the bill. But Senator Hutchings, that's the discussion that I heard on the floor.
Go ahead, Senator Hutchings, you have a follow-up.
Thank you, Andy. Mr. Chairman, Andy, this is addressed to you as well. Now, I'm not familiar with all the psychological things that are going on in the mental substance abuses and addictive abuses and all that. But one thing I am hearing is the national level. I get why you want to go that route to kind of streamline and pigeonhole kind of requirements. But then maybe there's a concern that if we go national, then we lose some of our local control and what we desire here in the state of Wyoming. I know now, the different associations where some things were of issue in the past, in the last 20 years, nationally, they're no longer an issue. Could the concern be that going national would change the way we have to do things in Wyoming?
Ms. Somerville?
Mr. Chairman, Senator Hutchings, I think, Senator, that the short answer is no, we don't have that concern. In general, in this system, federal, or I shouldn't say federal, I apologize, national standards are something that we're already working under and looking at and have been doing for quite some time. And as far as losing local control, I don't think that's quite an issue. And I would go to the end of the bill on page 3 that sets out this new pathway. That's not something that was pulled off of any national standards. That was something that we worked together, in consultation, talked with the board, Mr. Craig, all of those things to kind of pull those. And then also on page 2, it says that the board has to consult the professional training and experience standards of the appropriate national profession or standards of an appropriate federal agency. I think that passage notates that the board needs to be aware of those, what those are, and then the board can again continue to determine what's best for Wyoming. I would absolutely agree that Wyoming is not New York or California in terms of our provider availability, what we're dealing with here, the areas that we have to serve, including in our frontier areas across the state where provider shortages are very serious and a serious challenge. So again, I think with this bill, we're trying to push that. We're going to grow our own, but I think we still have that local control that you're looking for.
Thank you. Senator Furby has a question. Go ahead, sir.
Thank you, Mr. Chairman. Let me ask about continuing education standards. Do they have to meet some continuing education to stay up to speed in the area? Thank you.
Very good, Ms. Somerville. Everybody's shaking their heads. So go ahead.
Thank you, Mr. Chairman. Senator Furphy. Yes, they do have to meet continuing education standards. And I will wait for Mr. Searles to correct me, but I believe it's 45 CEUs. Is that correct? Or am I in the ballpark? I'm seeing maybe nodding heads. 45 CEUs every 2 years. And
Yeah.
sorry, CEUs is continuing education units.
Very good. And board and committee, that's another term you're going to hear a lot of. See, matter of fact, I think in the interim, I'll talk with Chairman Wilson, but I think that's something we're probably going to get some of these boards to come to us, both this board, medical board, nursing board, et cetera, and talk about their education requirements, their certification, their CEUs. And I think that's a good background, especially we have a lot of new members here and in the House. And that's valuable information because you're going to hear it time and time again. Any further questions, committee? No questions. You're off the hook, Ms. Somerville.
Thank you, Mr. Chairman.
I believe Mr. Searles is smiling next. We're going to let him speak up to us. Go ahead, man.
Good morning. Thank you, Mr. Chairman. I'm Greg Searles, the Executive Director for the Mental Health Professions Licensing Board. Really no testimony to provide, just here to answer any questions that the board or that the committee might have. And with that, we'll stand for question.
Or sit for questions, as it might be.
Correct.
Committee, do we have any questions of Mr. Searles? Yeah, Senator Bouchard, go ahead.
Thank you, Mr. Chairman. So my only question is there anything on this bill that we need to clarify for the board? I mean, I don't want this to go back and forth and have any problems here. I'd like to get this bill taken care of this time. So if there's anything we need to do, so we don't hear any negatives coming back, I'd like to solve them now. So thank you.
Thank you, Senator Bouchard. Mr. Searles, any suggestions or comments?
Mr. Chairman, Senator Bouchard, the board president, Kelly Heenan, testified on the House side. She was unavailable this morning due to the early nature of the meeting and having a family obligations. But she testified on the House side that no, there's nothing, that this bill has been worked out extensively over the last few years, and believe that this would be an amicable compromise to move the from a cap to, from a CAPA, the assistant level, to the cap, because you have the education, you have the experience, and you also have the exam requirement to become certified at that cap level at this point.
Thank you, Mr. Searles. Any follow-up, Senator Bouchard?
No, I just, Mr. Chairman, but I want to thank everybody on this bill. I think this is a good bill, and I appreciate it. And I'll be watching too. I want to hold everybody to it. So it's moving in the right direction.
Yeah, we will be checking in as we go through the years. And as everybody's alluded to, in particular, Senator Bouchard and Mr. Searles, and everybody that spoke so far, is that this has been a long time in the making, and it was not without controversy. It was not without a lot of discussion. And I think that leaves us with one final member who just popped back on our screen. You're going to have to tell me how to pronounce your last name, Lindsay, because I'll butcher it. If you go ahead and introduce yourself, and I promise to never mess up again.
No worries, Mr. Chairman. Lindsay Simino with the Wyoming Counseling Association. Forgive my ever-changing environment. I am in the throes of dropping my kids off at school. It just occurred, so we are good. As I said, I represent the Wyoming Counseling Association. We fully support this bill. As my colleagues, Mr. Craig and Ms. Somerville, have stated, this bill is the product of multiple years of work. And we do believe that we have come up with something that is going to work for the addictions profession within the state of Wyoming, and that it's going to address the workforce issue. What I would like to state today is that House Bill 3, which we're talking about today, and House Bill 4, which, as Mr. Chairman, you addressed, is still being worked in the House. They really are joint. That those were one bill that we split into two with the hopes of getting at least one of the issues addressed. That those are joint, and we would really much like to see those passed together in order to address the workforce issue in Wyoming as a whole. So even though those are not here in front of you this morning as a committee, we would like for you to keep that in mind when you do see House Bill 4, that is to also address the mental health workforce issue and get the mental health needs of Wyoming met as well on that bachelor's level issue. As far as the national standards, it's, as my colleague, Ms. Somerville, pointed out, it is not government control as much as it is evidence-based practice, research-based practice that we use as practitioners to ensure that we are practicing at our best level for the public. That is for both the safety of the public, but also so that we can give our best to the public and serve them the best that we can. In no way does that mean that we limit control locally. In fact, we have many state associations that then give that feedback to national associations who also inform those national standards. So there's very much a collaborative effort within the states and the counties. And so we do not see that as an issue as well. But yes, Wyoming Counseling Association stands in affirmation of this bill, and we hope that the committee passes it as well. And I stand for questions.
Thank you. Any questions from Ms. Semino? Excuse my cough. I do not have COVID. Senator Hutchings, go ahead.
Thank you, Mr. Chairman. I do hope Mrs. Semino is in the back seat, not driving.
I am parked. I am parked outside of my kids' school. Mr. Chairman, I am parked outside of my kids' school.
Very good. Very good. I was wondering. This is just an observation. All of you are from the same association. You're all colleagues. Is there anyone out there in the excuse me, the certification land that is against this, or is it pretty unanimous? This bill is going to take care of a lot of problems. That's the question, and anybody can answer that.
Ms. Semino?
Mr. Chairman, Senator Hutchins, we're actually representing very different perspectives of the mental health system. We have Ms. Somerville, who represents the community mental health centers throughout the state. I represent Counseling Association, so just the profession of counseling. And then we have Mr. Craig, who works within the prison system, but also with the addictions profession and represents within his addictions association, and Mr. Craig can correct me if I'm wrong, but addictions at a bachelor's level is what he has advocated for over the years. But I believe his association also represents addictions professions at a master's level as well. And so these are very dramatic sides of the mental health professions, and we have not agreed for many, many years. And this is very much a conclusion of that conflict. And it's one that we're very proud of, that we have come to an agreement. And so yes, we are all agreeing today, but that has not been the case. And so we are excited that we are here. We are excited that we have come with this product before you, and that we can stand here and say that we do believe this is good for Wyoming.
Thank you, Ms. Seveno. Mr. Craig, go ahead.
Thank you, Mr. Chairman. And Senator Hutchings, as an association that's Wyoming specific for addictions professionals, we also are an affiliate for the National Associations of Alcohol and Drug Addictions Counselors, NADAC, and I have consulted numerous times with their executive director and board regarding accepting what we're trying to do, and they're very much in support of that as well.
Very good. Any follow-up questions or further questions for any of these panelists? Oh, Ms. Somerville has a comment. Go ahead.
Thank you, Mr. Chairman. I just wanted to add, I would be remiss if I didn't explain we're missing one more perspective and association, and that is the social workers for the state of Wyoming. They are in the process, I believe, of hiring a new executive director. And so their board and their members have been apprised by myself and Ms. Semino of what's going on. And I don't believe that they have any opposition to that as well. So I just wanted to make sure we didn't leave them out. I'm sure someone from their organization will be joining us regularly in the future.
Thank you, Ms. Somerville. And not to worry, committee, we have several mental health bills in front of us yet, and addictions bills. You will see all of these folks again in the near future. Any further questions for any panelists or any further comments? Senator Hutchings.
Just a comment. I really appreciate the way everybody came together, helped with the acronyms, helped with the background behind this, instead of just, here's a bill, pass it, it's good. I like bills that are the right thing for the people, not the good thing for the people. And I'm sensing that this is the right thing. And I just want to let you know, I appreciate your input.
Thank you, Senator Hutchings. This is as close to a kumbaya moment as this committee gets right here. If there's no further questions, we'll let all these panelists go out, or attendees go out and watch the committee at work. If somebody would like to move the bill, committee.
I'll move the bill.
Bill is moved. Let's work through the bill. It's a short bill, so we don't have to go very far. Any comments or additions or questions on the bill, committee members? Not seeing any. Is the committee ready to move forward and call the question on the bill? I'm sensing that you're ready to move forward, and I would call for the question. Amanda, if you go ahead and like to take roll, please.
Yes, Mr. Chairman. Senator Bouchard.
Aye.
Senator Furphy.
Aye.
Senator Hutchings.
Aye.
Senator McEwen.
Aye.
And Chairman Baldwin.
Aye.
Mr. Chairman, you have 5 ayes. 6 ayes, sorry. 5.
I think we should do a standing division. I'm just kidding. Committee, I appreciate all that work. Attendees, all of you who are able to be here, I appreciate your work. Committee, not sure that we will have another committee meeting this week or not. There's a possibility, perhaps Wednesday. I'm leaning away from that. Our next committee meeting will likely be, I'm probably looking at the 24th of February. Similar to our last meeting, a 4-hour meeting. What bills, I'm not sure yet. But appreciate everybody's work, and it's good when a good bill comes before us. Senator Bouchard, go ahead.
Yeah, thank you, Mr. Chairman. I just want to let the new members of the committee know that we've worked on the issues, some of the issues in the last bill. We've worked on those feverishly for 2 years. And there's some, I mean, obviously this isn't groundbreaking on this bill, but I wanted you understand in health, sometimes you just got to back up and start moving together to make things work. And so that way the public is served in a better way by especially by licensing board. So I'm pleased that it was able to happen this year. So
I wish we could run a tape of when this first came before us on interim, and we first brought up this topic because there was not anywhere near this kind of agreement at that meeting. As Senator Bouchard can tell you, it was a pretty substantial disagreement between all the agencies. So we've come a long ways. It took a lot of work. Senator Bouchard had a lot to do with that. With that in mind, Senator Bouchard, would you mind floor managing this bill?
yeah, thank you, Mr. Chairman. I'll do that.
Very good. So that gets you off the hook for a while. Other committee members, some of the other bills that are coming up, you're going to be asked to floor manage. I won't ask you anything that you're not comfortable with, but with that in mind and no further questions, we'll go ahead and end this meeting for today. We'll see you all at 1 o'clock, and I'll hang around, Amanda, for you.